Hello everyone. Today we are going to discuss a very important topic for every Pharm D students, that is a case presentation skill. Whether you are attending ward rounds, clinical posting, seminar or university practicals, examinations, or case presentation is a skill you must master. Let's understand how to present a patient case in a clear, confident and clinically meaningful way. First, learning objective. By the end of this video, you will know about understand the importance of case presentation, learn standard structured format and apply clinical thinking and present patient cases confidently. Now first, what is clinical presentation? Clinical presentation is the systemic presentation of patient information in a structured format. It is commonly used during the ward rounds and clinical discussions, seminars and practical examinations. It helps in the clinical decision making and reflects your understanding of the patient condition and treatment. And next, why clinical presentation is important. Case presentations bridges theory and clinical practices and improves the communication skill and helps in identifying drug-related problems like medication error, drug-drug interactions and ADR, side effects, irrational drug use and polypharmacy and etc. and essential for the Pharm D curriculum. It strengthens the role of your clinical pharmacist and remembering you are not just repeating information, you are analyzing the therapy. And next, when do Pharm D students can present the cases during their ward rounds and clinical postings and seminars and presentations and university practical examinations. Next, a standard case presentation format is just a patient demographics including the patient names, age, gender and etc. Chief complaints, history of present illness, past medical and medication history, examinations and investigations, diagnosis, treatment and pharmacist role. And next we can discuss about one by one in the step by step. First one, patient demographic details. In that, a patient name with the initials and age and gender, weight, date of admission, and also we note about the date of discharge and which ward and which floor or unit. And next point is chief complaints, and that is presenting symptoms and duration of symptoms. For example, if the patient is having vomiting, we must mention how much episodes he is having or she is having and how many days are they are having. And next, mention in patient's own words, not to in medical terms, and avoid interpretations here. And next, history of present illness overview. Present means when the patient is coming to admit in the hospital, that is the present illness. Most common, most important section. Then chronological order shows clinical understanding and explain the progression clearly. And history of present illness details, onset of symptoms, progression and severity, aggravating and relieving factor and associated symptoms. And next, a past medical history, that is before admitting to the hospital, what are the symptoms or diseases they have. Example, diabetes, hypertension, asthma, COPD or previous surgical history, food history, everything. And what are the medication they are taking before the admission, current, what are the medications and dose, frequency, route of drug, duration of therapy, any OTC or herbal, drug usage, drug allergies and etc. And next, importance of medication history. Why medication history is important to identify the drug-drug interactions and detect inappropriate therapy and assess the medication adherence whether they are taking the medications regularly or not, prevent the adverse drug reactions. And social history, smoking, alcohol and their food habits and physical activity, they are walking, whether they are drinking or smoking, everything we want to know. And family history about their diabetics, hypertension, any cardiac and genetic disorders, we have to know for their family history. And next, physical examination. Physical examination generally shows about the vital signs, example blood pressure, body temperature, pulse rate, respiratory rate and general CV, cardiac and pulmonary examinations. Next, systemic examination. Here we saw the cardiovascular system, that is CVS sound S1 and S2, and respiratory sound system, whether their breathing is normal or abnormal, and CNS, that is central nervous system, and abdominal examination for their soft tenderness or something else. Next, laboratory investigation. This includes the lab test, everything, hematological test, biochemical imaging, whether CT scan, USG or MRI or biochemical, everything, and diagnostic reports. Laboratory investigations present tips mention abnormal values first, compare with the normal range and correlate with the disease condition, explain the clinical significations. We have to correlate with their symptoms and with their diagnosis test. And diagnosis, we have to professional diagnosis, that when the patient says some symptoms, we have to confirm whether this is the starting of the diagnosis, and this differential diagnosis we confirm with their laboratory investigations, and finally confirmed diagnosis is the appropriate diagnosis and treatment chart. Next is treatment chart. Here the drug name, dose, frequency and route of administration, duration of treatment has been done. Next, evaluation of treatment, appropriateness of treatment therapy and dose optimization and drug duplication and monitoring parameters have been monitored. Here is the role of clinical pharmacist to identify the drug related problems and adverse drug reactions, dose adjustment, patient counselings and therapeutic drug monitoring. Here is a sample patient case discussion with the demographics. A Mr. X, a 50-year-old male patient, weight is about 70 kg and date of admission is 10/1/2026 and the ward of cardiology ICU. He has the chief complaints of shortness of breath for 3 days, chest pain for 1 day and pain radiating to the left arm. And next is his past history is a known case of hypertension for 10 years and then irregular medication adherence and not a known case of drug allergies. An investigation source, that is vital sign source, his BP level is 160/100 mmg and ECG source ST segment changes and elevated cardiac enzymes, that is troponin test. His final diagnosis is like acute coronary syndrome and hypertension because his symptom shows that the chest pain radiating to the left arm and BP is 160/110, that confirms the acute coronary syndrome and hypertension. And next treatment chart gives the tablet aspirin and clopidogrel, atorvastatin, antihypertensive therapy and supportive care. And next, a pharmacist intervention should be medication chart should be reviewed and checked every drug for the interaction, counseling the patient on medication adherence and lifestyle modification advice. And tips for effective case presentation for the Pharm D students: be confident and calm, follow structured format, use proper medical terminology, and maintain an eye contact, practice regularly. And common mistakes to avoid: disorganized presentation, missing medication history, reading the slides directly without knowing anything, using casual language. And next, in the part of conclusion, case presentation is the in the part case presentation is the core clinical skills for Pharm D students. It improves your confidence and strength, patient care, and prepares you for real hospital practice. Practice regularly and you will master it. And thank you for watching. If you found this was helpful, kindly comment and like. Thank you.